Hi, so let's take a look at some supplements and some plant medicines that have a direct antihistamine activity. So you've got a whole range of plants again. You've got Albizia lebec, that's an Ayurvedic herb that's used extensively in India. I believe it's also used in China. Now, Albizia is a key herb that I use in my practice for reducing histamine levels. It works as a mast cell stabilizer, so preventing histamine being released. Also, it's a fantastic herb to be used, in asthmatics as well, or cases where the asthma is related to an allergy, an allergic type of scenario, because it helps to open up the airways, and also it helps to protect the adrenal gland, which we talked about. Now, it protects the adrenal gland from being damaged due to stress and so on. And as we know, the adrenal gland is so important for producing the cortisol, which helps to reduce the histamine, so a natural antihistamine. And it has some anti-inflammatory properties. So Albizia is a key anti-allergic plant, which I like to use. Then you've got plantain, common plantain, so Plantago major. That's a very key herb again for its antihistamine properties, but also it helps to heal the membranes in the respiratory system. So it's what you call a mucous membrane restorative. And there's a whole group of plants that have the ability to help to heal the lining in the body, not only in the respiratory system, but also in the digestive system and so on. The mucous membranes are so important. Then you've got Chinese skullcap, Scutellaria bicalensis. Now that's a good plant because it has an antihistamine effect again, but it also helps to relax the nervous system, and it has an antidepressant effect. Also helps the mind as well. So there again you can see the many different effects that one plant can have. There are a couple of supplements as well that I like to use. The first one is quercetin, which has been extensively researched, not just only for its antihistamine effect, but for many, many other effects. So quercetin is a mast cell stabilizer, helps to prevent the histamine being released from the cells. I've seen tremendous benefit using quercetin in a whole range of different patients. And then lastly, pycnogenol. So pycnogenol is an extract from French maritime bark. It's a type of pine tree. Now that has tremendous value as an antihistamine again. It prevents the release of the histamine from the cells, and it's actually very safe to use even in cases where people are very sensitive to other compounds. Now, depending on the level of treatment that the patient requires, there are different options available for treatment. So here at Health Matters, we have a herbal pharmacy where people sometimes they just drop in, they come into the shop and they say, oh, I've got hay fever, what can I take? Now you can give generic formulas, like in the pharmacy we make up a product called Allergics, which is a combination of plants working on those different levels that we talked about. And you can take that with some quercetin or some pycnogenol, and you can have tremendous benefit for your hay fever, for example. But if somebody has a more complex problem and they require a more in-depth treatment plan, then the benefits they will get from a consultation is much greater than just popping in and buying something off the shelf, because you need to sit down with these patients and go through their whole history. You need to examine them, you need to look at lifestyle factors and so on. For example, if somebody has severe asthma, you need to really sit down with them and go through the whole history and try to understand what plants would work best for that patient. Because it's not always straightforward. It's not like conventional medicine where you just take, say, a pill and hopefully that will help with the problem. You need to sit down to understand the nature of the patient, the nature of the problem. For example, if a patient is very wiry and very stressed, adrenal glands are very, very, very exhausted, they may have some fatigue with anxiety as well, then you mustn't use plants that are too energizing, like ginseng, for example, or maybe even schisandra, possibly even rhodiola. Some of these plants, these tonic plants, may be too overwhelming, too energizing for the weakened state of the individual, and that may cause anxiety or may worsen the anxiety. So initially you need to relax those patients as much as possible before you start to address the underlying adrenal problem, or you may choose a very gentle approach on the adrenal level. And that's where you need to look at the lifestyle and maybe implement certain techniques that we covered with the immunity video. For example, autogenic training, maybe some mindfulness approach, things like qigong, tai chi, yoga, specific breathing techniques that can help to start to relax the patient and look at the plan. So how are they living their lives? How much stress do they have in their life? Are they in an environment which is overwhelming with a lot of stress, in a situation where they're not even able to have lunch or to sit down and eat their lunch properly? So you need to look at all of these factors so that you can give the best treatment for the patient, and that will require an in-depth consultation.